Did you know that every 40 seconds, someone suffers a stroke, and in most cases, they never see it coming? What if the warning signs of a life-altering brain attack are happening right now, but you simply don't recognize them? Ischemic stroke remains the silent killer, striking without pain, yet capable of leaving permanent disability or even claiming a life within minutes. Are you prepared to spot the danger before it's too late? Now, before we begin, this video is intended for educational and informational purposes only, and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Ischemic stroke. Ischemic stroke stands as one of the leading causes of death and long-term disability worldwide. According to the World Health Organization, WHO, stroke claims the lives of over 5 million people each year, with ischemic stroke accounting for approximately 87% of all cases. This form of stroke occurs when a blood clot or other obstruction severely reduces or completely blocks blood flow to the brain, depriving critical tissues of oxygen and nutrients. Without prompt intervention, millions of neurons can die within minutes, a process that can irreversibly alter cognition, mobility, speech, and quality of life. In high-income and developing countries alike, stroke has emerged not just as a neurological emergency, but as a growing public health crisis. In the United States alone, the Centers for Disease Control and Prevention, CDC, report that nearly 800,000 people experience a stroke each year, roughly one stroke every 40 seconds. Alarmingly, about 1 in 4 of these individuals will suffer another stroke in their lifetime. What makes ischemic stroke particularly dangerous is its often silent and painless onset. Symptoms such as sudden confusion, numbness, or vision disturbances are frequently mistaken for less serious issues, resulting in dangerous delays in seeking treatment. Time is brain, and without rapid restoration of cerebral blood flow, the damage may become permanent. This video aims to unravel the critical facts about ischemic stroke, its causes, risk factors, warning signs, diagnostic processes, and evidence-based treatment options. By deepening our understanding, we can improve early recognition, timely intervention, and ultimately patient survival and recovery. Signs of ischemic stroke. Imagine this. You're sitting across the table from a friend during lunch when suddenly they drop their fork, their smile becomes uneven, and their words slur into incomprehensible sounds. Would you recognize this as the warning sign of a stroke, or would you dismiss it as simple fatigue or confusion? Ischemic stroke can strike without warning, and its symptoms often masquerade as harmless or everyday complaints. Yet, every second counts. Brain cells begin to die within minutes of oxygen deprivation, which is why early recognition is not just critical, it can be life-saving. The hallmark signs of an ischemic stroke are best remembered by the acronym FAST. F. Face drooping. One side of the face may appear uneven or numb. Ask the person to smile. Does one corner of the mouth droop? A. Arm weakness. Sudden weakness or numbness in one arm or leg, typically on one side of the body. Ask them to raise both arms. Does one drift downward involuntarily? S. Speech difficulty. Speech may become slurred, garbled, or completely lost. Simple sentences may be impossible to repeat correctly. T. Time to act. If any of these signs are present, immediate medical attention is required. Call emergency services without delay. Time lost is brain lost. Other potential signs include sudden trouble seeing in one or both eyes, severe unexplained headache, sudden dizziness, loss of balance or coordination, and difficulty understanding speech. Remember, a delay of even 15 minutes can mean the difference between full recovery and permanent disability. The sooner clot-busting therapy or surgical intervention is administered, the better the outcome. Never wait. Never guess. When stroke signs appear, Act fast because your quick response could save a life. Causes of ischemic stroke. What if I told you that the very habits you practice daily, the foods you eat, the way you manage stress, whether you smoke or stay active, could quietly be setting the stage for a devastating stroke? Many patients who suffer an ischemic stroke have no warning until the moment the blockage strikes, but the causes have often been building for years. The primary cause of ischemic stroke is the obstruction of blood flow to the brain, most commonly by a blood clot, thrombus, or a traveling embolus that lodges in one of the brain's arteries. When this happens, oxygen-rich blood cannot reach brain tissue, leading to cell death. Here are the most common underlying causes. 1. Atherosclerosis. A chronic condition where fatty deposits, plaques, build up on artery walls, narrowing the vessels and increasing the risk of clot formation. Atherosclerosis is driven by risk factors such as high cholesterol, high blood pressure, smoking, diabetes, and obesity. 2. Cardiac sources. Embolic stroke. Conditions such as atrial fibrillation, AFib, can cause blood to pool and clot in the heart, which may then travel to the brain, causing a stroke. Heart valve disease, recent heart attacks, and certain cardiomyopathies also increase this risk. 3. Small vessel disease, lacunar stroke. Chronic hypertension can damage the brain's small, deep arteries, leading to blockages and small, but potentially disabling strokes. 4. Other causes. Blood clotting disorders, hypercoagulable states. Certain autoimmune diseases, like vasculitis. Use of recreational drugs such as cocaine or methamphetamine. Neck artery injuries, carotid dissection, especially after trauma. But here's the truth that many overlook. Up to 80% of strokes are preventable. By addressing these causes early, controlling blood pressure, managing diabetes, quitting smoking, exercising regularly, and maintaining a heart-healthy diet, the risk of an ischemic stroke can be drastically reduced. Don't wait for symptoms to strike. Get your blood pressure, cholesterol, and heart rhythm checked regularly. If you have atrial fibrillation or other risk factors, work with your doctor to reduce clotting risks. Prevention is not complicated, but in the case of stroke, it can mean the difference between life as you know it and life with permanent disability. Symptoms of ischemic stroke. Have you ever woken up feeling lightheaded, with sudden numbness in your arm, blurred vision, or confusion and brushed it off as mere fatigue or stress? What if those fleeting, strange sensations were actually the early symptoms of an ischemic stroke? Many survivors later confess that they ignored these warning signs, not realizing they were seconds away from a life-altering event. The symptoms of an ischemic stroke can vary depending on the region of the brain affected, but they often share one critical feature: they appear suddenly and without warning. Here's what to watch for. Sudden numbness or weakness, especially on one side of the body, affecting the face, arm, or leg. This is one of the most common signs and can present as heaviness or total loss of function. Sudden confusion or trouble speaking. The person may slur their words, speak incoherently, or find themselves unable to understand simple speech, a frightening symptom called aphasia. Sudden trouble seeing. Vision may blur or become completely lost in one or both eyes. Double vision or loss of peripheral vision are also possible. Sudden dizziness, loss of balance or coordination. Difficulty walking, unsteadiness, or a feeling of spinning may indicate the stroke is affecting the brain's balance centers. Sudden severe headache. Though more common in hemorrhagic stroke, some ischemic strokes, particularly those involving large vessel occlusion, can present with an unexpected, severe thunderclap headache. What makes stroke symptoms especially dangerous is how easily they are dismissed as minor or temporary, costing precious time when immediate treatment could prevent permanent damage. If you or anyone around you experiences even one of these symptoms, don't hesitate. Call emergency services immediately. Every minute without treatment destroys nearly 2 million brain cells. Stroke is a race against time, and early action can spell the difference between full recovery and lifelong disability. Remember the golden rule. When in doubt, check fast. Face, arm, speech, time. Act fast. Think fast. Save a life. Before we go any further, ask yourself, would you be able to recognize these symptoms if they happen to a loved one, a colleague, or even yourself? Early awareness is the single most powerful tool in stroke prevention and survival. If this information is eye-opening, don't keep it to yourself. Share this video with family and friends you could help save a life. And if you want to stay informed on life-saving medical topics like this, consider subscribing and turning on notifications. Your knowledge could be the difference between rapid treatment and tragic delay. Diagnosis of ischemic stroke. What happens in the frantic moments after a suspected stroke patient arrives at the emergency room? Imagine this. A middle-aged man stumbles into the hospital, slurring his words, his right arm limp at his side. Is it a stroke? A seizure? A brain tumor? The clock is ticking, and every minute wasted could cost him the ability to speak, walk, or think clearly for the rest of his life. The first critical step in diagnosing an ischemic stroke is rapid clinical assessment, often beginning with a neurological examination to determine the extent and location of brain involvement. Emergency physicians and neurologists use standardized tools such as the NIH Stroke Scale, NIHSS, to quickly evaluate the severity of symptoms like speech disturbance, motor weakness, vision loss, and coordination issues. But symptoms alone are not enough. Imaging is essential to confirm the diagnosis and distinguish an ischemic stroke from a hemorrhagic stroke, bleeding in the brain, as their treatments are vastly different. Key diagnostic procedures include 1. Non-contrast CT scan of the brain, the fastest and most widely available method to rule out bleeding. In the first few hours, ischemic strokes may appear normal on CT, but bleeding can be quickly identified. 2. MRI of the brain, more sensitive than CT for detecting early ischemic changes, especially in the small vessels or brainstem areas. 3. CT angiography or Mr. Angiography visualizes the blood vessels in the brain and neck to detect blockages, stenosis, or arterial dissections. 4. Carotid Doppler ultrasound, used to assess the carotid arteries in the neck for narrowing or plaque buildup, a common source of emboli. 5. Echocardiogram, including TE, evaluates the heart for sources of emboli, such as atrial thrombi or valvular disease. 6. Blood tests, includes clotting profiles, glucose levels, to rule out hypoglycemia mimicking stroke, and infection markers. Time is everything in stroke diagnosis. Guidelines recommend that imaging should be completed within 20 minutes of hospital arrival to allow timely decisions regarding thrombolytic therapy or mechanical thrombectomy. If you or someone you know presents sudden stroke-like symptoms, demand immediate transport to a hospital equipped with stroke-ready facilities and imaging capabilities. Never attempt to drive yourself. Call emergency services immediately. Rapid diagnosis is the first and most critical step toward recovery. Remember, only with swift, accurate diagnosis can life-saving treatments begin. When it comes to stroke, the faster the scan, the better the plan. Treatment plan for ischemic stroke. What if you could reverse the damage of a stroke, but only if you acted within the first 60 minutes? For many stroke victims, the race against time begins the moment they lose control of their speech, vision, or movement. The right treatment, delivered fast enough, can mean the difference between walking out of the hospital and spending a lifetime in a wheelchair. When it comes to ischemic stroke, the treatment plan focuses on one urgent goal: restoring blood flow to the affected brain area as quickly as possible. Every decision made in the emergency room revolves around this principle. Key treatment strategies include: 1. Intravenous thrombolysis, TPA tissue plasminogen activator. The cornerstone of ischemic stroke treatment, TPA works by dissolving the clot blocking the artery. This treatment is only effective if given within a narrow window, ideally within 4.5 hours of symptom onset. The earlier it's administered, the greater the chance of minimizing brain damage. 2. Mechanical thrombectomy. For large artery blockages, doctors may perform a minimally invasive procedure called thrombectomy, inserting a catheter into the blocked vessel to physically remove the clot. This is most effective when done within 6 to 24 hours in selected patients, based on imaging and clinical assessment. 3. Antiplatelet or anticoagulant therapy. Once acute treatment is complete and bleeding is ruled out, patients may be started on aspirin or other antiplatelet drugs to prevent further clot formation. In cases related to atrial fibrillation or cardiac emboli, anticoagulants, like warfarin or DOACs, may be prescribed. 4. Supportive care. Includes oxygen supplementation, blood pressure management, glucose control, and prevention of complications such as brain swelling, infections, or deep vein thrombosis. 5. Long-term rehabilitation. Physical therapy, speech therapy, and occupational therapy are essential parts of recovery, aimed at helping patients regain lost functions and adapt to any residual disabilities. 6. Secondary prevention. Addressing underlying risk factors, managing hypertension, diabetes, high cholesterol, quitting smoking, and maintaining a healthy lifestyle is crucial to prevent recurrent strokes. If you or anyone you know shows signs of stroke, remember, time is brain. Get to a hospital that offers thrombolytic therapy and mechanical thrombectomy without delay. After the immediate danger has passed, follow medical advice, strictly including medications, risk factor control, and rehabilitation to improve long-term outcomes. Never underestimate a small symptom. A single fast decision can save a lifetime of abilities. Implementation of ischemic stroke care plan. What happens after the stroke crisis has passed? Many patients and families breathe a sigh of relief after surviving the initial event, but they often forget that true recovery and prevention begin after discharge from the hospital. Without a clear, disciplined plan in place, the risk of another, possibly deadlier stroke remains dangerously high. Effective implementation of a stroke care plan is not a single action, but a continuous process involving the patient, family, and healthcare team working together toward full recovery and prevention of future strokes. Here's how proper implementation unfolds. 1. Early rehabilitation. Rehabilitation should start as soon as the patient is medically stable, often within 24 to 48 hours. Physical therapy for strength and balance, speech therapy for communication and swallowing difficulties, and occupational therapy for daily living activities are crucial. Consistency is key. Small, daily efforts lead to big improvements over time. 2. Secondary prevention measures. To prevent another stroke, patients must adhere strictly to medical recommendations such as taking antiplatelet or anticoagulant medications as prescribed. Managing blood pressure, diabetes, and cholesterol through medications and lifestyle changes. Smoking cessation and limiting alcohol intake. Engaging in regular physical activity and maintaining a heart-healthy diet. 3. Regular medical follow-up. Routine follow-up appointments allow for medication adjustments, risk assessment, and early detection of new problems. Patients with atrial fibrillation or carotid artery disease may require periodic heart rhythm monitoring or vascular imaging. 4. Patient and family education. Understanding the signs of a possible recurrent stroke, knowing when to seek emergency care, and staying informed about lifestyle changes are vital. Caregivers should also be trained in supporting the patient's recovery journey. 5. Psychological and social support. Stroke survivors often struggle with depression, anxiety, or frustration due to loss of independence. Incorporating mental health support and connecting with stroke survivor groups can significantly improve emotional recovery. If you or your loved one is recovering from a stroke, do not stop at hospital discharge. Build and follow a structured recovery and prevention plan. Attend every rehabilitation session, take medications faithfully, track vital signs, and keep every doctor's appointment. Remember, recovery doesn't end when you leave the hospital, it begins there. Your discipline today determines your strength and independence tomorrow. Monitoring and follow-up. What if surviving a stroke was only half the battle, and the real fight lay in the days, weeks, and months that followed? Many stroke survivors make remarkable progress in the hospital, only to suffer setbacks later because they fail to maintain proper monitoring and follow-up care. Stroke recurrence is a silent threat unless the warning signs and risk factors are carefully tracked. The next event may strike unexpectedly. Ongoing monitoring and follow-up are essential parts of every stroke recovery journey. They ensure that risk factors remain controlled, complications are detected early, and the patient continues to regain lost functions. Here's how an effective monitoring and follow-up plan should be structured. 1. Regular medical check UPS. Stroke survivors need scheduled visits with neurologists, primary care doctors, and cardiologists if heart disease is involved. These visits track blood pressure, cholesterol, blood sugar, and overall cardiovascular health, the major drivers of stroke risk. 2. Imaging and diagnostic reviews. Some patients may require repeat brain imaging, carotid Doppler studies, or heart rhythm monitoring, especially if atrial fibrillation was the cause, to ensure no new risks are developing. 3. Medication adherence monitoring. Proper use of antiplatelets, anticoagulants, antihypertensives, and statins must be checked. Adjustments may be needed based on lab results or side effects. 4. Functional and rehabilitation assessment. Physical and occupational therapists reassess strength, mobility, and daily living skills regularly. If recovery plateaus or regresses, therapy intensity may need to be adjusted. 5. Psychosocial and cognitive monitoring. Mental health evaluations for depression, anxiety, or post-stroke cognitive decline are essential, as emotional well-being directly impacts recovery and quality of life. 6. Lifestyle compliance checks. Diet, exercise, smoking cessation, and alcohol moderation efforts are reviewed to reinforce long-term prevention habits. If you or your loved one is recovering from a stroke, never skip follow-up appointments, even when feeling well. Stroke risk remains high in the first year after the event, and only regular monitoring can catch silent threats early. Keep a health journal, track vital numbers at home, like blood pressure, and maintain open communication with your healthcare team. Remember, stroke recovery is not a single event, it's a lifelong process. Your vigilance today protects your health tomorrow. Prevention. Have you ever thought about how many strokes could be entirely prevented simply by making the right choices every day? Countless patients lie in hospital beds, unable to speak or move, because they ignored the silent risks building up over years: uncontrolled blood pressure, smoking, poor diet, and lack of exercise. The tragedy? Up to 80% of strokes are preventable. Preventing ischemic stroke starts long before symptoms ever appear. It requires a conscious effort to reduce the factors that quietly damage blood vessels and increase the risk of a blood clot forming in the brain. Here's how stroke prevention is best achieved. 1. Control high blood pressure. Hypertension is the leading cause of stroke. Regular blood pressure monitoring and adherence to prescribed antihypertensive medications can cut stroke risk dramatically. 2. Manage diabetes and blood sugar levels. High blood sugar damages blood vessels over time, increasing the likelihood of clot formation. Good glycemic control through diet, exercise, and medication is essential. 3. lower cholesterol levels. High LDL, bad cholesterol, promotes plaque buildup in arteries, narrowing the vessels and setting the stage for a stroke. Statin therapy, healthy eating, and lifestyle changes can reduce this risk. 4. Stop smoking. Smoking thickens the blood and speeds up clot formation, doubling the risk of ischemic stroke. Quitting smoking immediately begins to reverse this risk. 5. Maintain a healthy weight and exercise regularly. Being overweight, especially with central obesity, increases blood pressure, cholesterol, and diabetes risk, all stroke factors. Regular physical activity, even walking 30 minutes daily, greatly reduces stroke risk. 6. Limit alcohol consumption. Excessive alcohol intake raises blood pressure and can trigger arrhythmias such as atrial fibrillation, another cause of stroke. Moderation or abstinence is strongly advised. 7. Treat atrial fibrillation if present. This irregular heart rhythm dramatically raises the risk of stroke due to clot formation in the heart. Proper diagnosis and anticoagulant therapy are crucial for these patients. Prevention starts with awareness and action. Know your numbers, blood pressure, blood sugar, cholesterol, and keep them in the healthy range. Don't wait for symptoms to strike. Make lifestyle changes today. Quit smoking, exercise, eat heart-healthy foods, and see your doctor for regular checkups. Remember, the best stroke is the one that never happens. Prevention isn't just possible, it's powerful. Emerging trend for ischemic stroke management. Have you ever wondered how stroke care is evolving and how breakthroughs today could save lives tomorrow? The field of ischemic stroke management is undergoing rapid transformation, offering new hope for prevention, early detection, and better recovery outcomes. Here are some of the most exciting emerging trends shaping the future of stroke care, along with vivid examples from recent clinical practice and research. 1. Advanced neuroimaging for precision treatment. Newer, faster imaging technologies such as perfusion CT and diffusion-weighted MRI are now being used to identify salvageable brain tissue. The ischemic penumbra, long after the traditional 4.5-hour window for TPA administration. Do you know a 62-year-old patient presenting 9 hours after stroke onset was saved through the use of perfusion imaging, which showed viable brain tissue? He was successfully treated with thrombectomy, a procedure not previously considered so many hours after symptom onset. 2. Mechanical thrombectomy expansion. Recent trials like DAWN and Diffuse 3 have expanded the time window for endovascular thrombectomy up to 24 hours in carefully selected patients. This has dramatically improved outcomes for people who would once have been deemed untreatable. In one remarkable case, a patient who collapsed alone at home and was found unconscious 16 hours later underwent thrombectomy and regained speech and mobility, an impossible outcome just 5 years ago. 3. AI-powered stroke detection. Artificial intelligence is now being integrated into stroke diagnosis systems. AI tools like Viz.ai and Rapid AI scan brain images in real time to detect stroke changes and notify stroke teams, instantly reducing treatment delays. In a busy urban hospital, an AI system flagged an occlusion in a patient's middle cerebral artery before a human radiologist even reviewed the scan, allowing for life-saving intervention within minutes. 4. Wearable technology for atrial fibrillation detection. Since atrial fibrillation, AFib, is a leading cause of ischemic stroke, smartwatches and wearable devices capable of detecting abnormal heart rhythms are becoming powerful prevention tools. How a 48-year-old executive was alerted by his smartwatch to irregular pulses. A medical check confirmed AFib, and with prompt anticoagulant therapy, he avoided a potential stroke entirely. 5. Telemedicine and remote stroke units. Telestroke services are revolutionizing care in rural or underserved areas. Using high-speed communication, neurologists and city hospitals can guide local doctors in real time, ensuring prompt stroke assessment and treatment. A patient in a remote village received TPA just in time because a telestroke neurologist, connected via video call, guided the local team during diagnosis and therapy and intervention that would have been impossible just a few years ago. 6. Neuroprotective agents in clinical trials. Scientists are developing medications aimed at protecting brain cells during a stroke, reducing long-term damage. Trials of drugs like narinitide and NA1 are showing promise in limiting stroke injury, especially when combined with clot removal therapies. Experimental trials revealed that stroke patients given a neuroprotective agent before thrombectomy showed better cognitive recovery compared to those receiving standard care alone. Stay informed. The landscape of stroke prevention, detection, and treatment is evolving rapidly. Whether you're a healthcare provider or an individual at risk, awareness of these breakthroughs could change how you recognize and respond to stroke. Remember, in stroke care, innovation saves time. And time, as always, saves the brain. In summary, ischemic stroke remains one of the leading causes of death and disability worldwide, but it is also one of the most preventable and treatable if recognized early and managed appropriately. From understanding its warning signs and causes to seeking immediate treatment and committing to a lifelong prevention plan, every step counts. We've explored how rapid diagnosis, timely thrombolytic therapy, mechanical thrombectomy, and structured rehabilitation can make the difference between full recovery and permanent disability. We've also seen how modern innovations such as AI-powered diagnostics, wearable heart monitors, and remote stroke units are shaping a brighter future for stroke care. But none of these advances matter unless you take action. Your health, your responsibility. Know your risk factors. Control your blood pressure, diabetes, and cholesterol. Eat well, exercise, quit smoking, and moderate alcohol intake. Recognize stroke symptoms early and act fast. Don't skip follow-up care or rehabilitation. Time is brain. Every minute counts. Every choice matters. If you found this information valuable, like, share, and subscribe to our channel for more life-saving health content. Your awareness could save not only your life, but the life of someone you love. Have questions or a personal story about stroke? Share it in the comments below. Your experience could inspire and educate others. Stay informed. Stay proactive. Stay healthy.